Has traditional ED medication not been working for you? You've been feeling frustrated that your ED has been getting worse and nobody is able to find a solution for you? Have you talked to your medical provider and hasn't got a proper solution for the ED treatment? Then watch this video today. Hi, I'm Jay Patel and I'm certified physician assistant specializing in hormone replacement. Erectile dysfunction has been getting more and more common not only among older men but also in younger individuals. Recent advancement in treatment of erectile dysfunction has provided a new hope for those struggling with erectile dysfunction and most importantly for those who has not responded to the traditional ED medications like Viagra, Cialis. Here are the 8 of the latest breakthrough solutions for erectile dysfunction. Number 1. Low intensity extracorporeal shock wave therapy. This shock wave therapy involves using low intensity shock waves to improve blood flow to the penis. This is a non-invasive treatment, promotes the formation of new blood vessels and enhances the erectile function for stronger erections. Number 2. Platelet-rich plasma, or also known as PRP therapy. PRP therapy involves injecting the concentrated platelets from patient's own blood into the pineal tissue. The growth factor in PRP can promote a tissue regeneration and improves the erectile function or improve the symptoms of erectile dysfunction. Number 3. Stem cell therapy. Stem cell therapy uses regenerative potential of stem cell to repair and regenerate damaged tissue into the penis. This treatment aims to restore natural erectile function. So this is good for little longer term solution and it's not an instant fix. Number 4. Pineal implant with advanced technology. Newer pineal implants offer more natural erection and greater control. These implants can be inflatable or malleable, providing customizable solution for severe ED. This is ideal for somebody who has failed all the other treatments. Number 5. Neuromodulation devices. Devices that stimulates nerves involved in the erectile function such as dorsal pineal nerve are being developed. These devices aim to enhance nerve signal that triggers the erection. Number 6. Intracavernosal injections with advanced compounds. Newer compounds for intracavernosal injections such as avanafil offers faster onset and longer duration of action compared to the older medication like alloprostil. Number 7. Lifestyle and psychological interventions. Comprehensive treatment plan that includes lifestyle changes like proper diet, regular exercise, quitting smoking, cutting down on alcohol, and psychological counseling along with the traditional medication has shown to improve the outcome for many men with ED. So make sure you discuss the combination therapy. Number 8. Combination therapies. Combining different treatment modalities such as traditional oral medication with shockwave therapy or PRP therapy can enhance overall effectiveness and provide better results for patients. Combination therapy may combine multiple different options to give a better improvement in symptoms. These breakthrough solutions offer promising alternative for men with ED, particularly for those who have not responded well to the traditional treatment. So please talk to your medical provider, discuss your symptoms. Medical provider will evaluate your overall health and give you the best option that fits your health, lifestyle and improves your overall symptom with a minimal side effect. Make sure you talk to a specialist who deals with this type of problem on regular basis. You don't have to suffer from erectile dysfunction. Even if you are suffering from erectile dysfunction or if you have some other medical condition that's causing you to have ED, there is a solution for everything. So make sure you talk to your provider.